38-year-old man felt a chest pain in his chest. He thought it was stress. 2 hours later, he collapsed and died. My name is Dr. Bukhari, and today we'll discuss chest pain, which can kill you, your loved ones, and your patients. So, there are six most common causes of chest pain which you should never ignore because they can kill your patient within minutes to hours without urgent treatment. Number one is heart attack. Heart attack is one of the most common cause of chest pain. Our heart is supplied by small arteries which are called coronary arteries. And if these arteries are blocked by clot or atherosclerosis, that can result in heart attack. And if no treatment is done, it can kill your patient, it can kill you or your loved ones within minutes to hours. It can present with chest pain, which can radiate towards the epigastrium. It can radiate towards your stomach, or sometimes it can radiate towards your neck or towards your arm. Second common cause is aortic dissection. Out of our heart, there is a one big vessel which is coming out from our heart, and it is called aorta. If there is a tear developed in the wall of the aorta, the blood will actually start moving into the wall of the blood vessel through this tear, and this is called aortic dissection. Aortic dissection presents with severe chest pain which radiate towards your back, and it can cause death of the patient within minutes to hours. So this is, you can see the biggest one of the big vessel which is coming out from the heart. This is called aorta, and the blood is actually moving into the wall of the aorta. This is called aortic dissection, which is a life-threatening condition, kill your patient within minutes to hours. The next, which is the third most common cause of chest pain, which can kill your patient or your loved one, is cardiac tamponade. Our heart is surrounded by a wall, and it is called pericardium. It is a membrane. It's called pericardium. So pericardium has two layers. The layer which is very close to the heart is called visceral pericardium, and then the layer which is on the outside is called parietal pericardium. And in between these two layers, there is a fluid which is called pericardial fluid, and it acts as a cushion when our heart is contracting and relaxing. If this fluid increase for any reason like inflammation or infection, or if this cavity is filled with blood for any reason, it will prevent the contraction, the normal contraction of the heart, and it can result in cardiac tamponade. And this is again life-threatening condition which can result in immediate cardiac arrest. Cardiac tamponade can be diagnosed with point of care ultrasound. So any patient presents with chest pain, point of care ultrasound, which is also called POCUS, should be the part of workup at the bedside for any patient with chest pain. Number four is pulmonary embolism. Our heart has, you can see the heart has right atrium, and then the blood flow from our right atrium to right ventricle. From the right ventricle, you can see that the blood will actually go into pulmonary artery. So this is pulmonary artery, and from pulmonary artery the blood actually go into towards the lung on both sides. Now if this pulmonary artery is blocked by a clot and the blood is not able to flow out from right ventricle towards the pulmonary artery, or if the clot develop into the branches of pulmonary artery which are in the lung, this is called pulmonary embolism, and this is also a life threatening condition if it is not diagnosed at the right time. It can also result in immediate death. The next is tension pneumothorax. So our heart is surrounded by two lungs, the right and left lung on both sides of the heart. And if you look at the anatomy of the lung, uh, lung has an outer membrane. Immediately outside the lung, there is a membrane which is called visceral pleura. And the membrane which is close to the thoracic cavity, it is called parietal pleura. In between in between the parietal and visceral pleura, there is a pleural space. This pleural space is filled with very minimal amount of fluid for lubrication, and normally there is no air in this space. Now let's say if there is a trauma to the thoracic cavity, if there is a trauma to the thoracic cavity, which results in disruption of the thoracic cavity, the air will actually move from outside in between this pleural space, and it will compress the lung, which is called pneumothorax. The other possibility is if our lung rupture, if the wall of the lung rupture, the air will move out from the lung into this pleural space, and that will also results in collapse of the lung, which is also called pneumothorax. Pneumothorax is also a life-threatening condition because it can result in shortness of breath, and if it is severe, it can also compromise the heart. So if it does not diagnose properly at the right time, it can also result in immediate death. Number 6 is esophageal rupture. So the food we eat, it goes into the food pipe which is called esophagus. And let's say if there is a severe vomiting or severe retching during the episode of vomiting, or if someone has severe esophageal disease or severe gastroesophageal reflux disease, sometimes it can result in the formation of tear in the wall of the food pipe, and it can result in esophageal perforation. Because of this perforation, the content in the esophagus or the content from the stomach will actually move out from the esophageal perforation into the mediastinal or thoracic cavity. And sometimes this also presents with chest pain associated with vomiting or nausea. This is also a life-threatening condition. If does not diagnose properly, it can also result in death of the patient. So if I conclude my presentation, my final words are: chest pain is something which should never be ignored. Never ever ignore your patient with Chest pain. Some causes can kill within minutes, but the other can kill within hours. And the only difference between life and death is early recognition. So if you can remember one thing from this video, remember this. Treat every unexplained chest pain as an emergency until proof otherwise. Thank you for watching. Stay alert, stay safe. Thank you very much. Have a nice day.